All right, so anyone out there keeping an eye on India's economic situation, how things are shifting, especially if you're prepping for those UPSC exams well, all the talk about the latest Household Consumption Expenditure Survey, the one for 2023-24,
Yeah.
that's kind of a big deal, right? I mean, what we're seeing is household incomes are going up. And probably even more important, poverty seems to be dropping quite a bit.
Yeah.
Makes you think about what all this means for everything else, doesn't it?
Oh, for sure. It's the kind of data that shakes things up, Like we have these established ways of thinking, these policies that have been running for a while. When something this big changes, we really need to step back and see what it means for all those safety nets we have in place. Those programs designed to help people, especially the most vulnerable.
Absolutely, and that's exactly where we're going today on this deep dive. We're focusing on India's National Food Security Act,
Right.
the one from 2013, the NFSA. We're not just talking about some law on paper here. This is a huge program, like massive.
Yeah.
It's providing subsidized food to over 81 crore people. Just let that sink in for a moment.
It really is a massive program. And you've got to remember, it was designed based on what things looked like back in 2011-12, the data from that time. So when you get new info suggesting a very different picture, about how much people are spending and what's happening with poverty, well, it's pretty clear you need to reassess things, make sure a program this big is still working the way it should, being as effective and efficient as it can be.
Exactly right. So the big question we're tackling today, for all of you listening, is this. With incomes on the rise and poverty dropping, does the NFSA, the way it's set up now, does it still make sense? Is it reaching the right people? Are we talking about the right scale? We'll unpack the key findings from the latest data and get some expert opinions, all so you can get a solid grasp of this critical issue. All right, let's break it down. Starting with the HCES, the 2023-24 survey. What are the numbers that really pop out?
Well, the thing that hits you right away is how much people are spending now. It's a big jump. We're talking about the monthly per capita consumption expenditure, or MPCE. Now, in rural India, this figure has gone up to Rs 4,122. That's in 2023-24. But you've got to factor in inflation to make a real comparison, right? When you adjust those numbers to 2011-12 prices, it's the same as about Rs 2,079. So we're looking at a 45% increase in how much people in rural areas can spend. That's pretty big.
Wow, 45% more in rural areas. That really
Well,
tells you things are changing. What about cities? What's happening with urban spending?
yeah, the urban story is kind of similar. The MPCE in cities reached R6,996 in 2,634. Now adjust that for inflation like we did before, back to 2011-12 prices, and it comes out to about Rs 3,632. So it's a 38% jump. All in all, both in the countryside and in the cities, people have more money to spend.
Okay, so we've got a 45% increase in rural areas and a 38% increase in urban areas. For anyone listening, especially those UPSC folks, pay attention because these figures are important. What they're showing us is a significant change in the economic landscape. If people are spending more, it usually means they're doing better financially. And that's the context we have to keep in mind when we talk about the NFSA, the Food Security Act. Now, this isn't just about spending, right? We're also seeing a lot of evidence that poverty is falling, and it's coming from a lot of different sources, some pretty credible ones too.
Right on. It's not just one study or one set of data. It's like everyone's saying the same thing. You've got the State Bank of India, SBI. They put out a study recently in 2025, and they're estimating India's poverty ratio to be something like 4 to 4.5% in 2024. And they think the number of people in extreme poverty is around 6.7 crore. That's a big drop compared to what we had before.
Okay, so the SBI is saying poverty is down to 4 to 4.5%. How did they figure that out? What method did they use?
Well, they were using the Tendulkar poverty line. That's a specific way of measuring poverty. They adjusted it for inflation, of course. Based on that, their study shows a huge decline in rural poverty. It went from 25.7% in, FY12 down to just 4.86% in FY24. And urban poverty, also a big drop, according to them, from 13.7% in FY12 to 4.09% in FY24.
Wow, that's a big shift. But it's always good to look at things from different angles, right? What are some other organizations saying about poverty in India? Like, what do they think is going on?
Yeah, good point. The World Bank, for instance, they've also released their data, and they're basically saying the same thing. Extreme poverty is way down. They estimate it's at 8.7% of the population, so that's about 12.9 crore people, and this is for 2024. A big change from 2011-12 when they had it at 21.9%. And then there's the Multidimensional Poverty Index, or MPI. They don't just look at income, they also consider things like health, education, broader measures of well-being. Their findings for FY23 showed that only 11.28% of the population was living in multidimensional poverty.
So no matter how you slice it, whether you're looking at just income or you're using a broader measure like the MPI, it seems like everyone agrees. Poverty is down in India. And that leads us right back to that main question we wanted to look at. How does the reach of the NFSA, the Food Security Act, how does that match up with these lower poverty numbers? It seems like something might be off, right?
You got it.
Yeah.
This is where things get really interesting, and it's something everyone prepping for those UPSC exams needs to understand. Like we mentioned, the NFSA, it's providing subsidized food to over 81 crore people right now. That's 75% of the rural population, 50% of the urban population. It's a lot of people.
Right, 81 crore people. And if poverty is really around 10%, as those studies suggest, it sounds like the NFSA is covering way more people than it needs to. Like maybe it was designed to help 8 out of 10 people, but now only 1 or 2 actually need that kind of help. That's a huge difference with some pretty big implications.
Exactly. You've got a lot more people with more money to spend. They're not poor anymore. So a program designed to cover so many people, it might be reaching families who don't really need it anymore. They're not in that vulnerable group that the program was meant for.
Okay, so that brings up the next question. Why is it so important to take a closer look at these food subsidy programs now? It can't just be about the numbers, right? There have to be real-world consequences if things aren't lined up correctly.
Absolutely. We've already talked about how people are spending more, right? The HCES data shows that. So if people have more money, maybe they don't need all that subsidized food anymore. They can afford to buy more food on their own.
Makes sense. And as we've said, it looks like the NFSA is covering way more people than it should be, based on the poverty numbers. So that brings up questions about whether it's really working as well as it could be, whether it's reaching the right people.
And then there's the cost, right? I mean, the government's spending something like Rs 2 lakh crore every year on the NFSA. That's a lot of money. So the argument is, if you can figure out who really needs the help and focus the program on those people, you could save a lot of money. And then that money could be used for other important things like creating jobs, helping businesses grow, or building better schools and hospitals.
So it's not about taking away help from those who need it. It's about making the system smarter, more precise, and using the money where it's most needed. Okay, now, when we talk about poverty, it's important to remember that there are different ways to define it, different ways to measure it, and there have been different expert groups in India who've looked at this. Maybe we should dig into that a little bit, give our UPSC listeners some background.
Yeah, that's a good point. It's interesting how our understanding of poverty has changed over time. We had the Tendolkar Committee back in 2009. They came up with a definition based on how many calories people need to eat. They translated that into a daily amount of money, what people need to spend to get enough calories. It was Rs 27 per day in rural areas and Rs 33 in urban areas, and this was based on 2004-05 prices. This became a really important way to measure poverty in India, the official way.
Right. The Tendulkar poverty line, I've heard of that.
Yeah.
But there have been other ideas about how to define poverty, right? Other groups have had different views.
Exactly. And in 2014, the Rangarajan Committee, they said, hold on, poverty isn't just about calories, it's about more than that. They looked at what people were actually buying, their consumption patterns, and they also considered things like access to education and healthcare. Their poverty line was higher, Rs 32 per day for rural areas and Rs 47 for urban areas. Now, their report actually estimated a higher poverty rate for 2011-12 compared to the Tendolkar Committee, about 29.5% versus 21.9%. But the government didn't officially adopt their method. Still, it's a valuable way to think about poverty, an alternative way to measure it.
Okay, so we've got different expert groups, different methods, different estimates. Poverty is a complicated thing to measure for sure. Now, with all this new data about spending and these different ways of understanding poverty, what are some of the specific things experts have said we should do about food subsidies? Like, how do we make them work better?
Well, there have been a lot of suggestions. The Shantakumar Committee back in 2015, they said we should make the public distribution system, the PDS, smaller. They thought it should cover only about 40% of the population, to make sure the subsidies are going to the people who really need them. Now, a big change like that, reducing the coverage to 40%, wouldn't that leave a lot of people without help? What about the people who are still vulnerable?
Right, it's a valid concern. The committee thought that with better ways to figure out who needs help, and by really focusing on the most vulnerable people, the system could be more efficient. Less waste, less leakage, and that kind of thing. But of course, some people are worried about making sure everyone who needs help actually gets it, making sure no one falls through the cracks.
For sure. And besides the overall size of the program, people have specific ideas about how to make it work better. One big idea is to use data more effectively, what they call data-driven targeting. So they want to use the information from the 2023-24 HCES to update the lists of people who get benefits from the NFSA. And they want clear rules about who should be included and who shouldn't be.
Okay, that makes sense. Use the latest information to make sure the help is going to the right people. What else? What other ideas are out there?
Another big one is to change the way the subsidies work, but to do it gradually, step by step. The idea is to keep the current level of support for the Antyodaya Oryana households, the AAY households. Those are the poorest families, and they get a larger amount of food. But for the priority households, the PHH, which is a bigger group, they're thinking about switching to direct benefit transfer, or DBT. So instead of giving people food, the government would put money directly into their bank accounts. That way people have more choices about what food they buy. And there's also talk about slowly reducing the amount of subsidized food for families who aren't poor anymore based on the new data.
So a gradual transition instead of a big sudden change. That seems smarter. What about technology? Can technology help make the system better?
Oh, absolutely. Using technology to make things more transparent, that's seen as crucial. They're talking about using those Aadhaar-linked databases and even things like AI, artificial intelligence, to keep track of everything. This could help prevent people from cheating the system and make sure the benefits are going to the right people. And if you connect these databases to other records, like tax information about cars and jobs, then it would be easier to keep the lists of beneficiaries up to date and maybe even remove people who shouldn't be getting benefits anymore.
Right, so technology can help make the system more efficient and less prone to corruption. Another interesting point that's come up is the idea of focusing more on nutrition, not just on giving people enough calories. What's the thinking behind that?
That's really important. It's not just about giving people enough to eat. It's about making sure they're eating healthy food. So people are talking about including more fruits, vegetables, and pulses in the subsidized food program, things that are full of nutrients so people can avoid problems like anemia and stunted growth. A recent report, the State of Food Security and Nutrition in the World report from 2023, found that a huge portion of India's population, something like 74%, couldn't afford a healthy diet. That's a pretty scary thought.
Wow, 74%. That's a lot of people.
Yeah.
It shows that just giving people enough to eat isn't always enough to keep them healthy.
Exactly. And then there's this idea of local purchasing with DBT, giving people money and letting them buy food from local shops. This could save money because it's cheaper than transporting food all over the country. It also gives people more choices and helps support local businesses.
It sounds like a win-win, for sure. Lastly, there's been talk about a universal basic income, or UBI. How does that fit into all of this?
UBI, or even just unemployment benefits, is a different way of thinking about social safety nets. It's about giving people money directly, just enough to live on. The argument is that as India's economy changes and people's needs change, we might need to think differently about how we help people. Giving people money directly gives them more flexibility, they can decide what they need most, and maybe we won't need those broad food subsidies anymore.
Right, it's like a more adaptable safety net. So just to be clear, can you remind us how the NFSA benefits work now? Who gets what?
Sure. There are two main groups, the Antyodaya Anna Yojana, or AAY, households, and the priority households, or PHH. AAY is for the poorest families, like landless laborers, really poor farmers, people who earn very little money. There are about 9 crore people in this group, and each household gets 35 kilos of food grains every month at a very low price.
And what about the priority households?
Yeah, the PHH, that's a larger group. It includes other vulnerable people, and each state decides who qualifies based on their own criteria. This group has about 72 crore people. Each person in a PH household gets 5 kilos of food grains every month at a subsidized price. So a family of, say, 4 people would get about 20 kilos of food grains.
Okay, so most people in India are currently getting subsidized food. Now, as we wrap up this deep dive, what are the key things you'd like our listeners to take away, especially those studying for the UPSC?
The main thing is that the new data from the HCES and other sources shows that poverty is down significantly in India and people are spending more. So we really need to rethink the National Food Security Act, the NFSA. It was designed based on old data, and it might not be working the way it should anymore. This isn't about taking away help from the poor. It's about making sure the help is reaching the right people and that we're using our resources wisely, spending the money where it's really needed.
Right. It's about making the system smarter and more efficient. And for our listeners, especially those preparing for the UPSC, it's crucial to understand these debates about poverty, consumption, and social welfare programs. This is something you might see on your exams, so you need to be able to analyze the data, understand the different opinions, and think about the policy implications.
And here's a question for you to think about. How should India's social safety nets change as the country's economy changes? Should we move towards more direct financial assistance, like UBI, or focus on nutritional security rather than just providing food grains? It's a complex issue, but it's really important for India's future.
Definitely a lot to consider and essential for anyone who wants to understand what's happening in India. If you found this deep dive helpful, please give us a like and subscribe to the deep dive for more in-depth discussions on important topics. And let us know your thoughts and questions in the comments. Oh, and by the way, the main source for all this information was Business Line. Thanks for listening to the deep dive.